Thank you. I'm delighted to be here, and hopefully the next 10 to 15 minutes I will give you empowering information that will enlighten you and hopefully enlighten many, many more people that you can influence as we move forward. So the title of my talk is You Cannot Drug People into Being Healthy. A little bit about my background. I'm part of an independent health think tank, the King's Fund. I'm a trustee there. I work with the medical Royal Colleges. I just want to start by quoting the late, great Stephen Hawking. A few months ago, the chair of the General Medical Council, Professor Terence Stevenson, said about the medical profession, we need to exercise more humility and less hubris. And one of the greatest scientists that we have ever seen said something very similar. The greatest enemy of knowledge is not ignorance. It is the illusion of knowledge. And that applies to modern medicine as it stands today. So I'm just going to start with this slide because I think it's a very important slide. As a cardiologist, as a clinician, my duty and responsibility first and foremost is to my patients to do what's best for them. And I use my individual clinical expertise, the best available clinical evidence, and most importantly, patients' values and preferences should be being used to try and improve patient outcomes. But the father of the evidence-based medicine movement, Professor David Sackett, the late David Sackett, he actually said this: half of what you learn in medical school will turn out to be either dead wrong or out of date within 5 years of your graduation. The trouble is, nobody can tell you which half. So you have to learn on your own. And as a qualified doctor for almost 17 years, I have sadly, slowly, and reluctantly come to the conclusion that honest doctors can no longer practice honest medicine. We have a complete healthcare system failure and an epidemic of misinformed doctors and misinformed patients based upon a number of factors. Biased funding of research, that's research that's likely to be funded because it's profitable, not beneficial for patients. Biased reporting in medical journals, biased patient pamphlets, biased reporting in the media, commercial conflicts of interest, defensive medicine, and last but not least, medical curricula that fail to teach doctors how to comprehend and communicate health statistics. The situation of overprescription of medications has become so dire that Peter Gosha, one of the co-founders of the independent Cochrane collaboration, has estimated that prescribed medications are now the third most common cause of death globally after heart disease and cancer. This is perhaps not surprising when one appreciates and understands that the pharmaceutical industry that funds most of the research that we base our clinical decisions on have a fiduciary obligation to provide profit for their shareholders. They do not have an obligation, as people would like to believe, to provide us with the best treatment. But the real scandal is that those with the responsibility to scientific integrity and to patients, that includes influential academics, universities and institutions, and medical journals, collude with industry for financial gain. Between 2009 and 2014, the criminal activity of most of the top 10 pharmaceutical industry companies has resulted in fines of almost $14 billion for illegal marketing of drugs, hiding data on harms, and misrepresenting research results. John Ioannidis, I would consider probably the Stephen Hawking of medicine, professor of medicine and statistics at Stanford University, recently published a paper where he had also analyzed around 60,000 clinical research studies and concluded only 7% of them fulfill criteria of being both high quality and relevant to patients. We keep hearing about an innovation crisis. It's not a surprise we have an innovation crisis. Most of the new drugs that have been approved in the last couple of decades are essentially copies of old ones. No therapeutic value over previous drugs. Perhaps not surprising when industry spends at least twice as much on marketing than they do on research and development. One of the former editors of the #1 impact medical journal in the world, New England Journal of Medicine, has concluded after 20 years that it is no longer possible to trust much of the clinical research or to rely on physicians or authoritative medical guidelines. Is she alone? No. Richard Horton, editor of The Lancet, wrote an editorial a couple of years ago where, in a private meeting of some of the world's most senior academics, concluded possibly half of the published medical literature is untrue. And the other issue we have in British institutions is, unfortunately, because of the system, because of a system failure, there is a culture of covering up fraud, essentially. Richard Smith, former editor of the BMJ, again wrote about the fact that in a meeting of academics of senior of institutions, big institutions in the UK, he asked the audience, how many of you are aware of a colleague in your career, in your department, being involved in fabrication of data or research misconduct? A third to a half put their hand up. He asked them, how many of you have reported it? Everybody put their hand down. The medical establishment is aware of this problem, and I worked closely for a year, and I'm still in touch with them in a part of a steering group. The Medical Royal Colleges launched a campaign in 2015, very much aware of this problem of overprescription, called Choosing Wisely, in an effort to reduce the harms of too much medicine, which is a real problem, in fact, is at the root of our healthcare crisis. At the same time, has over-medication detracted from lifestyle? Well, absolutely. We have a public health crisis with obesity. More than 60% of the adult UK population are now overweight or obese. Perhaps more disturbingly, by the time they leave primary school, 1 in 3 children are also in the same category, and so far the trends are getting worse. The costs to the NHS and the economy are staggering. Type 2 diabetes, an entirely preventable condition, is costing the NHS and the economy, due to lost productivity, close to £20 billion a year. And that's estimated to hit 40 billion by 2035 if we do nothing. And again, I think there are lots of debates around the science of nutrition, but ultimately the major root cause behind this obesity epidemic is the processed food environment. It's become almost impossible to avoid cheap, sugary, processed foods. Predominantly, contrary to popular belief, is processed carbohydrates. Most of these processed foods are coming from starch and sugar, not from fat. But for me, the biggest scandal, is where my journey started many years ago, is that we've even allowed our hospitals to become a branding opportunity for the junk food industry. In 2010, when working as a specialist registrar in a hospital I will not name, could be any hospital actually, doing interventional cardiology, I operated on a man in the middle of the night doing keyhole heart surgeries. An interventional cardiologist came in with a heart attack. We saved his life. 3 a.m. Next morning, I'm on the ward round. As I'm telling him to take his medications religiously, I'm also talking to him about stopping smoking and following a healthy diet. And as I'm talking to him about following a healthy diet, he gets served a burger and chips by the hospital. And he looks at me and he says, "Doc, how do you expect me to change my lifestyle if you're serving me the same, pardon my language, crap that brought me here in the first place?" And it got me thinking, and I looked at the data, I looked around me, I knew that actually a lot of what was being served in hospitals to staff and to patients was really essentially junk food. It's now estimated more than 50% of NHS employees, of the 1.4 million NHS employees, were overweight or obese, doctors and nurses. Perhaps not surprising to understand that education is ineffective when the food environment is working against you. How important is diet in all of this? Well, actually, according to the Lancet Global Burden of Disease reports, poor diet is now responsible for more disease and death than physical inactivity, smoking, and alcohol combined. But the definition of a poor diet has also been sorely misunderstood, mainly based upon flawed science and commercial influence. So as part of my journey in the last few years, I went to a village in southern Italy called Pioppi, which has an average population of around 200 people, with an average life expectancy close to 90 for men and women, and many people living over the age of 100, but they age well. They're not on lots of medications. They're not a particularly affluent society. And we wanted, myself and in the picture, my co-author, who's a former Northern Irish international athlete and a film producer, we went to this village to try and discover what were their secrets, and how could we marry those secrets with what we know of independent medical research. And we wrote a book called The Pioppi Diet, which really is an evidence-based lifestyle plan to really empower individuals, but for me, more importantly, knowing that we need health policy changes really across the population to help many, many more people to influence politicians. And I was honoured that it got mentioned in the UK Parliament last year, and I spoke about it briefly in the European Parliament last week. But the book essentially gives people tools to empower them to change their life. And a few of the myths that we busted is one is the Mediterranean diet has been wrongly interpreted. Eating fat, providing you cut the carbohydrates of processed food, eating fat does not make you fat. And saturated fat does not clog the arteries. Cholesterol can be good for you. I was involved in a systematic review which showed that if you're over 60, high LDL cholesterol, the so-called bad cholesterol, is not associated with heart disease. And actually, overall, high cholesterol is inversely associated with mortality. In other words, you're less likely to die if your cholesterol is high. And I've had patients come into my consultation room who've been told by their GP, my cholesterol is high, ladies in her 60s, and I said, congratulations, you're going to live longer. And they've left my consultation room much more reassured and happy. But perhaps the most important message of all, of what I've learned as a clinician, is that lifestyle changes, dietary changes, can be more powerful than any drug in both preventing and treating heart disease and come without side effects. And those effects are rapid. Now, this is an anecdote, but I get lots of messages from people that have read my work and other people who are doing similar things to me. And Stephen Tai is a chap I've never met. He posted this on my Facebook wall, but essentially he was a type 2 diabetic with high blood pressure for many, many years. And he decided to ignore his doctor's advice and look at things independently himself. And within months of changing his diet, he was able to come off his statin medication, his metformin for his type 2 diabetes, which reversed or certainly came into remission, and he normalized his blood pressure. And he's a very happy man. So this stuff does work. Perhaps, regretfully, the pioneering heart transplant surgeon Christian Barnard said towards the end of his career, I have saved the lives of 150 people with heart transplantations. If I'd focused on preventative medicine earlier, I would have saved 150 million. It turns out lifestyle is that medicine. Thank you very much.